She also did her farrier education and was employed as a farrier in the School of Leipzig University. In 2020, she set up a practice of equine orthopedics and rehabilitation in Germany, and she speaks nationally and internationally. Jenny.
Thanks, Dan. Okay, thank you for coming. I hope you can hear me more as well. It's early, but we have a good topic and it's one of my favorite topics, so I really hope that you will enjoy it, and we will talk about uneven feet. That means the high-low syndrome, as you sometimes call it, or hoofs with uneven angles or sizes. So the question is, are all hoofs the same? So if we see a horse with a steep and a flat foot, is it always the same reason? Can we treat them all the same? And I would say no, as we can see later. The only similarity is actually that the reason for developing uneven feet is uneven load. So that means the right and left limb is not loaded equally. Usually we see it more on the forelimbs because we have the more static load affecting this part of the limbs. The hind limbs can develop it as well, but it's not that often, but we see it definitely, yeah. So the first thing, if you see horses with uneven angled feet or sizes in the feet, you should ask yourself, or the horse or the owner, what could be the reason for the uneven load. And I defined 3 reasons, and for you I try to explain it more or less separately, but they all can come and affect the hoofs together, so be a little bit careful. But for our protocol, I would define these 3 reasons for causes as for developing the uneven feet in horses. So it can be that you have just a natural skewness. We will define this term later on. So this is just the asymmetric development of the whole body in a very young age. So that means also the hoofs of these animals can be more or less uneven angled or uneven in size. But still, there could be also laterality, what is comparable to the handedness. Yeah, that's also causing an uneven use of the body and therefore uneven load of the feet. Or it could be just a relief posture because the horse is in pain. Yeah, then again, we try to relieve the affected hoof. The problem is a little bit depending on the cause, natural skewness, laterality, or pain. It has a very different effect on the function of the hoof. So in particular on the timing of the motion pattern, like breakover, landing, mid-stance. It also has a different effect on the motion of the limb and swing phase. So that makes it complicated to find a good solution. So usually people or farrier ask, shall we correct the angle? Shall we adapt the angles of the hoofs? Shall we leave it like it is? What can we do to improve the situation? And it really depends on the underlying reason, yeah? Okay, and usually people think very mechanically, so that there was actually also in the textbooks, but if we look also in the farrier schools, usually people think very mechanical and think, okay, the steep hoof has always an average position to break over because the leverage is less. So people think that the steep hoof always have the faster breakover, yeah? So it doesn't need that long to go into swing phase. In the other way, people think if you have an acute angled hoof, you have a long toe, a long leverage, so that must make the breakover slower. Yeah, so it's more effort to break over. And we will definitely clarify this thing. And I can tell you already, it's not always the case. Yeah. And the second thing is that we have also some ideas how an angle of the hoof affect the flight pattern in swing phase. Usually people think again, if we have a flat acute angled hoof, we have more leverage, more resistance to the ground. So the peak is earlier and higher in swing phase, while, for example, a steeper hoof should break over smoother and easier, and the peak should be later in swing phase. Again, we can make a question mark here. Yeah, so these are more or less the assumptions we are dealing with, and my aim is usually with my research to clarify some assumptions and give some facts. And I think I can give you some for this one. Okay, so we start with the first package. We start with uneven feet because of natural skewness. Natural skewness is something we find everywhere. So if we would check our bodies, we could definitely see that we are not symmetrical. And in particular, our skeletal structures, ligaments, joints, tendons might develop asymmetrical between left and right. This is something quite natural, so it's very rare that we see pure asymmetry in nature. And we know that, of course, the whole skeleton might affect how the whole body is built and also how the hoofs are loaded. Yeah, as we saw yesterday, the hoofs are always the symptom carriers from the function above the feet. And we definitely know in horses and humans as well that we have asymmetries in the passive locomotor system. It can be in the spine, it can be in the long bones of the ligaments, of the limbs, it can be in the joint surfaces. Depending where it develops most, we see it more or less obvious. And from this structural skewness, of course, functional skewness can develop. Yeah, so if your skeleton is a little bit asymmetric, you will definitely also function a little bit skew. Yeah. Okay. So to give you some ideas from the literature, we definitely know that we have asymmetry in the thorax. We also know that we have skeletal asymmetries in the pelvis, and we definitely know that the long bones like the femur or the humerus can be also slightly different. We talk about very few millimeters. It's not that we see a big difference, but you can definitely measure it if you make your dissections. Yeah. Can be that we have it in the breeding, it might be the genetics, sometimes it might be random, but we definitely see asymmetries. And there was also a very nice study from Watson, sorry. He also showed that 76% of horses have asymmetries also in the distal limb, like the cannon bone, the length of the first, second, and third phalanx, the width of the phalanges. So everywhere we see slight asymmetries, also in the carpal and tarsal joint. So what are we talking about? Yeah, if we have slight asymmetries in the skeleton, it is very likely that we see also asymmetries in the hoofs. Yeah? And depending on the individual, asymmetries can be more or less obvious and more or less strong. So that is actually very logical that we see some hoofs or some foals developing different size and angle in their feet. Yeah? And as I said, if we have skeletal asymmetries, we definitely use our body very functional asymmetrical. And we know as farriers, what does it mean if we work very asymmetrical? So everybody who is a farrier know that we are very skew, I would say at least, and that the function of our body is very well adapted to our work. And I can promise you that also your skeletal tissue will adapt to the more or less unilateral load. Yeah. And it's also determined in your neurological pathways. So if you're slightly skew and if you're foal developing with a slight asymmetry in your skeletal, your whole neurological pathways will adapt to the situation. So for the animal or for you, your skew body always feels straight. That's something neurological because it's in your neurological system. Yeah. And if we measure asymmetries, in particular functional asymmetries, we usually look for these things, and you will see it later. I shortly explain what you see. We have little sensors we attach to the hoof wall, and it's measuring 20 or more strides and making an average. And what we see is usually the yellow left foot, the red right foot, and this is the average pattern of the flight arc. So we are looking from the side. And you can see we have a slight asymmetry in the height of the flight arc, so the left foot has a lower flight arc. Yeah? And then we have the sideway motion, so we are looking from the top on the hoofs. So here's the start of swing phase, and again we have the right and left foot. So we have a very straight movement in swing phase from the left foot and winging out at the right foot. And we have a little shadow around the line. So the highlighted line is always the average, and the shadow around it is the variation between the measured strides. So you see more variation in the strides on the left foot and less on the right foot. Yeah, this is how you read these images. Can I have something like a yes if you got it? Yeah, thank you very much. Sometimes it's a little bit difficult because I see it every day and then I explain it and everybody thinks, what? And the same is valid for the timings. So we always have yellow left, red right foot. This time the front feet. We also can measure, of course, the hind feet. And we have the timing for mid-stance, breakover, swing phase, and landing, and the difference between the left and right foot. Yeah, this is how we read the next slides. Okay, so we definitely know that horses often show quite slight or sometimes very obvious asymmetries in their swing phase or in their stance phase pattern. And there were other research groups showing also the pressure distribution. We did it as well, but we have not published. But we also know that sound animals, even if you don't have any pain, any pathology, if you made a complete check of the animals, even if they don't have any sign of pain or any pathology, they have a slight asymmetry in weight bearing. It would be the same for you. If I give you some pressure plates or pressure mats and I let you stand on there, I'm very sure that most of you would slightly lean to one side, even if it feels straight for you. Yeah, because again, you also have always have a stronger, a weaker leg. You might be a little bit skew. Yeah, so that's something natural. We can't expect that all hoofs between left and right are always loaded the same in similar way. Yeah, that's almost impossible. So, okay, that's a little bit the background about skewness and asymmetry. And the reason for developing skeletal asymmetries is that it starts already very, very early. So you have to know that in the first year, the whole bone tissue is substituted to 100% to adapt to mechanical load and to grow. Yeah, that makes it very sensitive to any kind of asymmetries. For example, sometimes it's inherent that we have folds in the uterus laying a little bit skew, or they have difficult births, so we have to pull a lot on their legs and on the growth plates. Or it's genetics, that you have genetically asymmetries in the skeleton. But also in a young age, it can happen that you have folds with limb deformities, like Robbie Miller told us yesterday, or you see inflammations of the growth plate, or you have slight relief posters because the foal has any issue and is in pain, what is always an emergency. Pain in foals is usually an emergency because they load the skeletal very asymmetrical. And of course, we can have young foals with laterality. So there we already come to the next term. But it's typical that we have foals preferring one limb standing in front and in the back for grazing. We know all these things. And this causes usually also asymmetric development of the whole passive locomotor system. Yeah. Yeah, well, that's what we see. So actually our main aim, if I'm working for my breeders, we try to check the foals, see if we have limb deformities, but also we check if they are by nature a little bit lateral. We have a stallion, for example, in one of my stud farms who is definitely giving laterality to the foals. We know it already. Yeah, and then you know a little bit you have to take care for these little guys and keep them as, let's say, symmetrical and manage them as good as you can. We also do sometimes body work with them. Can help a lot. Okay, so the functional asymmetries definitely cause and maintain structural asymmetries and therefore also the development of uneven feet. And I always try to bring a case report for you. So we see now a little girl, it was a mare. She had a very difficult birth, as you can see. She came with the back end first, so we really had struggled to get her out. And she's windswept, as you can see, and she has also tendon laxity in the flexor tendon of the left hind limb. She is extremely skew in the pelvis. As you can see, that was her main problem. But we could see after 2 days, she's already started to develop uneven front feet. That's the first message. So if you want to shortly wake up, sometimes if you see uneven feet in the front feet, it's just a symptom because you have a very skew pelvis or a scoliosis in the spine. Yeah, so sometimes it's worth it. If you can't find any problem in the fronts, then you should check the function and symmetry in the hinds. Yeah, that's very obvious. In this foal, it developed extremely fast. Yeah, you could see after 2 days standing, very skew in the back, the front limbs developed very uneven. And our aim was for sure to stabilize this part. So that was, I think, the second or third day, I'm not sure about it. But we first started to care for the tendon laxity, that the foal can walk. And then we worked with medial and lateral extension after 1.5 weeks to correct the varus and valgus conformation in the hind to make it more or less straight again. And it worked quite well. So it developed as a very, very nice little foal, became more or less straight and very active. And as soon as we corrected the skewness in the pelvis, the skewness in the hind end, we saw a direct effect on the high-low conformation in the front, and it decreased again. So actually, as I said, the fronts were just the symptoms because of the skewness in the pelvis. Keep it in mind and always check the whole body and not just focus on the uneven front feet. That's usually not helping. Yeah. And if you correct it in young foals, you have a very good effect and you can keep them more or less fine and symmetrical. This foal don't show any asymmetries in the front feet anymore, and in the whole body it's actually fine without a slight little bend in the cannon bone of the left hind limb. That's it. Yeah. Okay. But let's check another mare. This is a good friend of mine. She's called Erica. And Erica is definitely natural skew because she has since a foal. That's the first thing. If you have a owner with a horse with uneven feet, you definitely ask, since when is this conformation existing? If they tell you, yeah, since ever, since I got it, since it was a foal, then you can be sure that you have a natural skewness in the whole body. The skeleton might be asymmetrical. Yeah. In this case, Erica always had these uneven feet since she was a very young foal. Nobody cared for it properly. And you can see we have 10-degree difference in the angles. So the right foot is definitely steeper than the left foot. And her whole body above is very, very asymmetric. The shoulders, the spine, also the pelvis, yeah, you see it in the whole body. Of course, you have a different height of the carpus. And now is the big question, what shall we do with these horses? So if we leave the angles like it is, it will become more and more asymmetric in the feet. As I said yesterday, the hoofs are growing always there where they have space. So usually on the steep hoof, they destroy the dorsal wall, so they grow more and more in the heels and get steeper and steeper. And on the flat foot, usually they have more pressure on the heels, so they grow in the toe and they become flatter. So we have to find a good way to care or maintain more or less the natural conformation of this horse. So the hoofs will be probably always slightly different, but we should take care that it's not getting worse. Yeah. So what I usually do in these cases where I can definitely exclude a pain situation, I adapt the angulation by trimming the grown heels and trimming the grown toe. This is nothing special, just whatever you do in a normal horse. But you have to be aware, if you shorten the heels of the steep hoof, you bring more tension in the deep digital flexor tendon, and usually you make it more difficult for this hoof to break over, right? So if you shorten heels, you bring it in a flat conformation, you make it more exhausting for the horse in breakover. That means if you shoe the horse, you'd have to give actually more breakover to the corrected steeper hoof, because there you shortened the heels. The flat hoof, the acute angled hoof, is always fine because you shorten the toe, very nice, it's easier for the hoof, you just give a nice little break over in the shoe, everything is fine. Yeah? So don't make the mistake and always bring too much break over in the flat hoof. Care for the steep hoof. And that's what I did here. We see Erica's hoof before trimming. We have 10 degrees difference in the angulation, with the left hoof is the flat one. And the steep hoof, as you can see, behaves mechanically correct, so we have a very fast break over on the steep hoof, a shorter mid-stance, a little bit shorter swing, and a difference also in the landing. Yeah? So the asymmetry is medium. Sometimes it can be worse, sometimes it can be less, but we see definitely asymmetries. So what I did, I shortened the heels of the steep one and I shortened the toe of the flat one, and I gave more break over to this steep right foot, and you can see a decrease of timing asymmetry. Yeah? Usually the riders also feel it. Erica is going a little bit in dressage, not very high level, but she can do it, and the rider is very sensitive. She is quite happy. That's also something you always have to ask the rider. Is it feeling better? Is the horse comfortable? Is it moving good? Yeah. The question is, we can't change that Erica is skew. Yeah, her whole skeleton is skew. So that means I can't wait 8 or 12 weeks to come back, because then for sure the hoofs will look definitely the same. So usually we have very short trimming intervals and shoeing intervals for these horses. And here you could see after already 6 weeks, Erica started to get skew again. Yeah, so that means probably this horse would be better with 4 or 5 weeks trimming and shoeing interval. Again, I corrected it, and this time I decided, because I had time and I wanted to check it, I did a manual therapy for 45 minutes and also 20 minutes corrective training, like a rehab training. And we can see after the training, it was completely symmetrical. This is not always by zero, but usually we have at least a good effect on these horses if we somehow relieve a little bit this posture, if you work a little bit with their body, that at least the functional asymmetry decreases. And if you imagine you work together as a farrier and a body worker and maybe as a trainer, and you come together at these horses, the manual therapist or the trainer can maintain or support the work of the farrier. The more symmetrical the function of the proximal part, the more even might be the load on the feet, and the better is your work as a farrier and the more sustainable. Yeah. So that means these cases are usually the most easiest uneven feet you can meet, because okay, it's manifested in the skeletal, and yeah, it's not, we will not make a completely symmetrical horse out of it, but we can definitely make a nice angle correction, we can improve the function by shoeing, and we can definitely affect the horse with the manual therapy and training. Again, focus please on the steep hoof. Give enough breakover if you cut the heels. If you shorten the heels, you have to compensate it with the breakover in your shoe. Very important. Okay, let's come to the next situation. We have laterality. That means we have a handedness in the horse, so the horse prefers to use the left or right side for specific tasks. Again, this is very natural. It's made by nature that we have two brain hemispheres with different tasks. That's a multitasking approach of nature, and it's a big advantage in evolution. And in horses, we have the situation that we have, for example, the right part of the brain responsible for all short-term things like stress reaction, flight, control of new situations, while the left brain hemisphere is more or less for controlling known situation, long-term memory, approaching other animals or humans. So we have a very clear sensory motor laterality in horses, yeah, because the eyes are very lateral. You have a very clear crossing in the brain hemispheres. So 80% of the information from the left eye is crossing to the right hemisphere and the way around. Yeah, so in conclusion, horses are very lateral in general. Yeah. What I don't like is if people say we have a weak and a strong hand. That's not really true. Yeah, it feels sometimes like this, but we actually have two body halves with different tasks. I prefer to say we have a stable hand and a very mobile hand. For example, if you're farriers, usually if you're right-handed, your left hand is the tongue hand, and you can make a lot of force and long-term, long-lasting force to keep the shoe and the tongue stable. While your right hand is the hammer hand, where you move and you can make a very precise little movement. And this is something valid for horses as well. Usually you have horses with, if they are just lateral, with a very strong and stable side and with a more flexible side. If the rider is telling you, for example, my horse is better in going on the left turn, usually it's because they are more stable and more strong on their left side and can support the body weight much better, so they have more freedom to bend. While, for example, the mobile side on the right one isn't that strong and not that static. That means they fall a little bit inward, so they make little, like the motorcycle again, yeah, so it's very hard for them to make a correct bend because they miss the strength on this side. So we call it a little bit like, we call it mobile and stable side. That means on the stable side we have more tonic muscles. Tonic muscles are muscles which has the whole time a muscle tone. For example, your neck muscles work against the gravity, so they are always more or less on. Yeah? While, for example, your arm muscles, they can be very loose. You just use them for basic movements, so that means motion up and down or flexion extension. Yeah? Often we see diagonal pattern in these horses. And what we know, now it gets a little bit complicated, but we can try to go through it. On the stable side, I said we had a more developed tonic musculature. So this is, for example, the serratus muscle. You saw yesterday in my slides we have this huge muscle connecting the shoulder blade to the trunk. If this is very well developed and strong and very stable, the horse is very good in supporting the passive structures of the distal limb by this muscle. So you have less passive load on the more stable limb. While, for example, the more mobile limb, where you have less activation and less strength in the shoulder girdle, you definitely have more movement, but you have less muscular support, so you have more passive load on the hoof. So usually these hoofs are more compressed and show the flatter conformation. That's the pattern we see, at least in these horses. Yeah? So you can say at the more stable side is the steeper hoof, on the more mobile, weaker side, if you want to tell it like this, we have the flatter hoof. You definitely see it in the conformation. You have to imagine if you have more muscles, you can, if you are riding, I think you know it. If your riding teacher tells you engage your body, engage your belly, you have less pressure peaks from your seat bones on the saddle. We can measure it. Yeah, it's a little bit the same here. If you have muscular support, you have less pressure on the hoofs. For example, might be that the stable side is more or less in this conformation because the muscles take some part of the weight. So we have less compression of the digital cushion and less pulling on the dorsal wall and less flattening of the sole. On the other side, the weaker side might be that more passive load is affecting the hoof. So we have more compression of the digital cushion, more pulling on the dorsal wall, more flattening of the sole in acute hoof angle. Yeah? This is how hoofs react to the load. Or we have it as well, if we show from the back, yeah, this might be that this is the hoof from the more mobile side, we have more passive load, while, for example, if we have a better muscular support, we usually see this conformation. So often we have the less loaded hoof, where you have more strength in the muscles, also a little bit more narrow, and the hoof which is flatter usually gets also a little bit wider. Yeah, that's what we also see. We did some little measurements, how, for example, the muscle status of the horse affects the hoof angles, and we know if you put horses in box rest, of course they lose muscles. They are moving animals. They have to move the whole time steady to increase and activate their trunk muscles and their core stability. If you put them in a box, usually they lose muscles quite fast, and we saw a decrease of hoof angulation just because of the loss of muscles and more passive load at the hoofs. And in the way around, we know if we train horses and we activate the musculature, we can increase hoof angle short and long term. We also see it in our rehab stables. So if you really engage them, if you increase core stability, you definitely relieve the passive load of the hoofs. And this always works unilateral as well. Yeah. Okay, reasons for motor laterality are, of course, genetics. So it's inherent to a very high degree. It's sometimes also unilateral development because we might have structural asymmetries, as we said. And I think it's also a lot of keeping. The more possibilities the young foals have to have access to the field, go uphill, downhill, different motion pattern, usually the less handedness they develop. And it's getting worse if you have monotone training. Yeah, like this little guy in the middle was a pony in India, carrying a wagon, so it was a driving pony, and it was always going the same circle in the same village, the same round every day, and it was completely asymmetric and had a strong handedness for sure, but this is very special. What we definitely know by research is actually that we have a genetics, so that means we definitely know that foals develop a preferred grazing step, so usually one limb is in front, one is in the back. Also related to their body conformation, the longer the legs, the shorter the neck and the head, the more they have to spread out and the more obvious becomes the laterality. And you can imagine the forelimbs, the front foot here has a lot of pressure on the heels and is growing into the toe. Here this hoof in the back has a lot of load on the dorsal wall and grow in the heels, so this one will get steeper. Yeah. So this is something, again, quite natural. We just have to check if you have breeders. I recommend, at least, I mean, I can't change how they breed often, but I can recommend, okay, this stallion definitely has a genetic predisposition for laterality. This mare or this stallion always make very long legs, so we might have more problems also with limb deformities. So this is something we definitely should discuss with the breeders. And we know that's something you can again ask the owner. If you meet an owner and they're saying, okay, my foal was actually quite nice, the feet were even and symmetrical, but in the age of 2 to 3, 4, 5, it developed the uneven angulation in the front feet. Then this is usually related to more handedness. Yeah, you can imagine if the foal by skeleton is actually more or less symmetrical, so we can exclude natural skewness, and it's just quite lateral, and during training, during growth, maybe the people start working the horse a little bit, this laterality usually becomes more obvious, and these young horses start slightly over months, sometimes a year, developing uneven angulation in the feet. This is usually a sign that you have a lateral horse next to you. Yeah. And there I also brought you a little case report. That was one of the very first uneven angled hoofs I made, I think. And it was in a dressage horse. Sorry, this is coming soon. Yeah, so dressage and unilateral, not voltage, it's voltage. Yeah, is it called voltage if they go in circles? Yeah. So this is something very, very heavy for horses. It's also very uneven unilateral load for these horses, even if they train in other circles, but usually it's not enough. The good thing is we can, if we just have a lateral patient, if we just have a handedness in our horse, there is a study, it's very old, but I think it is a quite good one, because they took sport horses, which were more or less mid-age, I would say, and where they could see they have a defined laterality in their use. So they have a preferred way to go in a circle, they have a preferred way to go on a lunge, and they tested the laterality and saw we have a high incidence. Yeah, so more or less all horses, except maybe, actually all horses showed a handedness. And the good thing is they trained these horses with a corrective training over 6 to 30 months, which is quite wide, but we know that we don't need that much time. Usually in our rehab stable, we need maybe 3 to 4 months to see the first things. If you make a good corrective training, it's very easy. So you can imagine if you're a right-handed farrier and you break your arm, what I don't hope, but if you have an injury in your arm and you can't use it, your left hand will start using or fulfilling tasks of the right hand. Yeah, somehow you have to compensate your injury. And after a while, your left hand will improve doing motoric tasks from the right hand, right? You know what I mean, I hope at least. Yeah. So this is something good. We can train against laterality and handedness. And it's proven by literature. And we don't know it from our practical things. So this is the case report I wanted to show you. This is a voltage horse I met years ago, and it was quite good performing, but it had really uneven and very ugly feet when I met it the first time. And you can see we have an angle difference of 13 degrees. And we can see the left foot is the steeper one. It's a voltage horse, so it's usually going or more has more load on the left turn. So you can imagine the left limb always have to support the weight of the horse and of the riders on top. Yeah, so that means probably it's stronger developed in the static musculature on the left foot, and the right foot is following, and it's a little bit more mobile. And you can see it in the measurement. You can see the steeper hoof has the lower flight arc and is definitely more stable. And the right foot, which is usually following, is also very mobile, so it's fitting a little bit to the pattern of a handedness for a stronger left hand at this particular horse. And what we see in the timings, that's also something. The steep hoof is the steep hoof is the left one. And it has a very fast breakover, so this fits, and a very long mid-stance. As I said, it's the supporting limb of the horse, so it has a long mid-stance. It takes a lot of weight. Yeah, the muscles are really well developed on this side. The angle is steeper. The other hoof is the mobile one, where we definitely have a shorter mid-stance, and we have a longer swing phase. Yeah, that always shows a little bit that this is the more mobile side. So I was very young and I thought, okay, these hoofs are looking very ugly. That was, I think, one of the first uneven feet I measured. So I thought it's a good idea to make an angle correction, that it's not getting worse. It was working quite well. Enough hoof was grown, and you see the angle changed, the difference to 5 degrees, what is quite okay for the horse. Unfortunately, I think I have not considered enough how much I really took from the steep hoof, although they are just 4 degrees less, but in swing phase, the horse became indeed symmetrical. So from the first view, I was like, oh yeah, that's moving nice. but from the timings and also from the report of the riders and the owners, they said somehow it's not so good, it's not so active, or it can't move very well. And we saw an increase of asymmetry in the timings. So this is usually an indicator for discomfort or dysfunction. Yeah? So it doesn't mean that all horses have to be completely symmetrical. Yeah? But if you see increases of asymmetries after your work, it's usually not the best sign. Yeah? I thought maybe the horse adapts because I really liked the angles. Unfortunately, after 6 weeks, it was still fine in swing phase, but definitely not fine in the stance phase. You can see it's even more asymmetrical. Yeah? And there we always have a problem. With the laterality patients, they are the most complicated patients you can actually get if you have uneven feet and if you have to work with them. What I know now, that's why I show you the case, it's always good if you find a communication with the trainer and maybe with the rider. Because first of all, you need somebody who makes the corrective training of the horse to find a better motor, motor skills that the horse is loading and using the body more even. Because it's not just the hoofs suffering from this uneven monotone training and the load. Yeah, it's the whole body. So it's always beneficial if you speak with the trainers and the owners to find a training protocol to compensate this unilateral load of the disciplines. Oh, wow. It's like disco. And you definitely have to ask critically your shoeing concept. If it's not working, you can't rely on symmetry. We have to respect the conformation of the horse and the art. And I think the best thing of farriery is if we can respect the individual conformation in a way to maintain it and to maintain the function. Yeah, so it always have to be both. We can't just say, I want to have things symmetrical. So laterality is critical. That's easy now. Pain is very easy. That's why we have it to the last. So usually we have one limb affected by pain, and the other limb has to bear the weight. And we see also in walk and trot, of course, that we have an uneven load of the limbs. So if we have a horse with acute pain, it's very, very clear that we can measure asymmetries in load. So we see the pressure curves of the left and right front foot of a lame horse. And you can see the right front, which is affected, definitely bears less weight than the left one. The good thing is if we have acute pain, it's very easy to solve. We just, in this case, we gave anesthesia to the foot. Wow. You're funny, guys. And if you solve an acute pain, yeah, the horse directly reacts. So you give a painkiller, you give some medications, and all of a sudden you have a better and more equal weight bearing at the hoofs. So the first aim, if you meet a patient where the owner tells you it developed the uneven feet very sudden, so over 1 or 2 shoeing cycles, it can't be a laterality and actually not a natural skewness, because in particular if the horse is older than 10 years. It's too old for natural skewness, and it's actually also too old to develop laterality, and it's very likely with 10 years that you start to have some little issues. And the horse don't have to be really lame to develop a relief posture with an uneven load of the feet. Yeah, so it can be very, very subtle. So it's not the fault of the farrier if a horse develops an uneven angle in the feet. It's probably because a relief posture. So we did some studies with, actually now we have more horses with 90 horses with diagnosed lamenesses. And what we definitely see that in chronic cases, we usually have the steep hoof, the primary affected lame limb, and compensatory, the flat foot is bearing more weight and can develop a secondary damage. But if we have horses showing this conformation, I prefer to have the first diagnostics on the steep side, and maybe we can check the second diagnostics for the flat foot if we see some secondary damages there. Yeah. So I will explain this, you don't have to read it. You can imagine if your foot is aching, yeah, and you hit the ground by landing, you have a very dynamic and very high impact by landing. So you try to make it careful. Yeah, if you have pain in your limb, you will make, oh, ouch. Yeah, so you make it very slow. Then you have the mid stance where your maximum weight is on your limb. So this is painful. So you make ouch, yeah. So you go very fast back to break over, and again pushing and break over is very difficult for lame horses as well. So we see also a very careful dynamic phase and break over. So that means usually we have a very clear lameness pattern in these horses. So we have a very long breakover because it's painful, it's more careful. Sometimes, depending on the pathology, also a very long landing time, but a very short mid-stance because this is painful. That's what we see more or less. So what we see in this case, this is acute lameness due to deep digital flexor tendon injury. And as I said, this is acute as relative, so it was already a few weeks, but you can see already due to the relief posture, the hoof gets a little bit steeper. We have a very short mid-stance on the hoof and a very long breakover. Another example, we have a chronic lameness because of the cystis in the coffin bone, and we see this pattern again. Yeah, so the lame limb is the steep limb, and now it's getting complicated. The steeper hoof has the longer breakover because we can't think mechanical anymore because we have to deal with pain. Pain is ruling everything, even mechanics. Yeah, if you have pain, you can't think about anything else. Yeah, so your whole body is focused on pain. So that means we have the steeper hoof with the longer breakover and less comfort, with a longer landing and short mid-stance. So I think it's not a very good idea in a pain patient to start with angle correction in the hoof. They are painful anyway. Yeah? So what we try to do in these patients is to increase comfort and to decrease pain. So that means we don't play around with the angles, we just try to give comfort by our shoeing, and the vet should come probably to make diagnostics and give some pain medication, for example. Yeah. And I brought you another case. So this is also a good one. This is a horse with podotrachlosis, and the left front is the more affected one. So that means we have the left front, which is definitely from the navicular bone more destructed and showing the steeper angle, a long breakover, very long breakover. There's a difference of 35 milliseconds, which is really quite something, and a very short mid-stance because this is the more painful, more lame limb, yeah, and a very long landing. So this is a typical pattern for bone-related lameness and pain, yeah. And that's also something in patients with natural skewness and laterality, we see the asymmetries more obvious in walk, because this is usually a gait where you see asymmetries much better also with your eye. In the pain patients, we also see it in trot. Yeah, so this is something you would see as lameness by the head node and maybe asymmetries in the pelvis. So there was not an option to do angle correction. You can see I kept the angle as it is, but the horse was shot with aluminium and a medium elastic pad to protect the navicular bone and just a little bit magic cushion to make a very, very soft filling. So you have shock absorption, a light shoeing, good breakover, and no pressure on the navicular bone. And although the angle is completely the same, we just changed the comfort. You can see we have a decrease of asymmetry. It's always a quite good sign. If you have pain patients, the more symmetrical they get, the less pain they usually show, the less lameness you see. Yeah. And this horse was also treated with osphos or with a medication which should improve the pain level in the bones and also should decrease the destruction of the navicular bone. And after 6 weeks, you could see a further improvement. Yeah, again, the angles are still the same, but more comfort, medical treatment, less pain, less lameness, more symmetry. Yeah. So these horses are not working mechanically. If you would have corrected angles here, I think you would have made a very bad mistake for this horse. And after the second shoeing, further improvement, it was completely fine. So this was a show jumper, and they started to bring it back to training, unfortunately, but they wanted to give it another season, so they started to train the horse, and after 4 months, it was worse again. Yeah. Still the same angle. Yeah, it's just related to the pain level of the horse. You see more or less asymmetries. So that means if you are a farrier and you have a horse where you expect you have a pain patient, I would not recommend to make angle change. I would definitely suggest diagnostics focus on the steeper hoof primarily And it's definitely relevant to have a good pain management and a relief and make an orthopedic shoeing to improve comfort. If you can't heal the underlying disease, you will not get even feedback. Yeah, so then they will stay asymmetrical. Okay, since you don't have your pressure or your sensors with you, I developed a little protocol how you can go to your clients. Usually if you have horses with uneven feet, I ask them for the time of occurrence. Is it since the foal? Is it coming in the age between 2 or 6? Is it since the horse is older? We check the muscle status. Is it very asymmetrical? Do you see, for example, a laterality with more tonic muscles on one side or more phasic on the other? Or do you see, for example, a unilateral fatigue of an overloaded bearing limb because of pain and relief posture? Yeah. Then you can, of course, ask for performance. Is it normal? Does the horse show any resistance to go into one side in a bend? So a sign of laterality. Is the poor performance decreasing? Or how is the duration? Was it developed since ever or developed very, very slow? Then it's usually more laterality. Or is it very short term, 1 or 2 shoeing cycles? That's usually pain. Yeah. And sometimes you see already pain symptoms. Yeah, so if you just make this check, I think usually I'm quite good in already assuming laterality, skewness, or pain. I can measure them, but usually you're quite close if you consider this one. Yeah. And for the management, if I concluded, natural skewness, just go for good angle adaptations because I think you maintain the function of the body and you prevent a further increase of the skewness. Care for the steep hoof if you make a shortening of the heels and try to work with a good modification in the toe to improve the breakover so you can make an asymmetric breakover depending on your correction, and consider manual therapy. Work together. It's always a kind of collaboration. Same for laterality. Be a little bit more critical. I would still recommend to adapt the angles, but be careful and try to really review your shoeing and if you should make more or less breakover and how the horse is working. And then it's really a little bit try and error and try to find a trainer who's working with you and try to correct at least a little bit or train a little bit against the laterality. I know from our training stable that we definitely can decrease laterality to a minimum in horses because they are really good in motoric learning if you work with them. Yeah? And pain, no angle correction, increase in comfort, good diagnostics and pain management. So I think if you just consider this and make a good collaboration, you can deal much better with high-low syndrome patients. Yep, that's actually the talk about high-low syndrome. I think we are good in time. Yeah, more or less, I mean, I expect the technical issues, but I think there's time for questions if you want.
Perfect, thank you, Jenny.
A true professional. I set those lights to go up and down just to see if I could put you off your stride, but you were good. Have we got some questions for Jenny?
Hi. Considering this a natural...
You have to hold it a little bit, thank you.
Like this?
Yes, that's better.
So when you talk about the laterality, most people are right-handed. Do you have any kind of percentage how many horses are left or right? Kind of handed, stronger?
Yeah, depends on the population. So if you have feral horses which are not interacting with humans, it's actually half-half. So that the percentage is very equal. In horses which are in a domestic use, usually we have a higher incidence of left-handed. Also in some breeds it's described, but I would doubt a little bit all the numbers. It's varying between 60 to 80%. Really depends a little bit how they are trained and how they are bred and what they are. But it's increasing a little bit in the domestic horses. Yeah.
Thanks. You mentioned corrective training for the horse. You mentioned corrective training for the horse. I know it's outside us as a farrier, but what should we be advising a client to do if it does need corrective training? What sort of exercises are involved?
Wow, that was a little bit difficult. It's very noisy. I couldn't hear it very well. Either you say it louder or then have to shout into the microphone.
you mentioned corrective training for the
Yeah.
horse.
Ah, yeah, that's better. Hmm?
Yeah, okay. What sort of recommendations would you follow for that? I know it's outside us as farriers, it's more of a trainer, but what
Yeah.
has a trainer got to do and what can you advise an owner to get the trainer to do?
Yeah, I mean, as a farrier for you, I don't know your background. Yeah, so if you are also very good in training horses and you have some ideas, you can recommend something. But if
Yes, I have my own horses.
okay, but if you're, let's say you come just as a farrier and the owner hired you for as a farrier, not as a trainer. Yeah, I would always work together with the trainer in the stable and use try to communicate. Come on, here's a lateral patient. The hoof's showing it already. So how is the horse in training? And a good trainer should have some ideas how we make a corrective training. If we get them, if for example, if we have the stud farm where we have more lateral foals, we start them a little bit earlier from groundwork. So with already 1.5, 2 years, we start to make good, there are different exercises, I can't tell you all the exercises, but we start them from groundwork and teach them a good motoric skill to make a correct bend and increases the core stability. In the end, you make a lot of core stability exercises combined with things like tensile training, equikinetics, pole training, going in the countryside. We have a specific way of lunging them so that we improved, it's no magic, we improve the skills of the horses. As a farrier, I would not recommend specific training methods if you are not really a trainer, but then you should use communication with the trainer at least.
Tell the rider to get a trainer.
Sorry?
Tell the rider to involve their trainer.
Why or what? How?
Yeah. If the horse is that wrong,
Yeah.
we should be suggesting to the rider that they have to involve their trainer more.
How I do it?
No.
Huh?
He's just confirming that you need to advise the rider to get the training.
Yeah, so if
That's-
that's it. Yeah, that's what I meant. I usually don't say to the rider, you have to ask your trainer for corrective training, because then you have always the person in the middle. What I try to do always if I come as a farrier, I go to the trainer, or I call the trainer, depends a little bit how you can meet them, and I really discuss the specific course with the trainer. That's my point. Yeah, because the rider is always unreliable. I'm sorry.
Anyone got another question? When you're trimming your upright foot, do you have, what sort of guidance would you go by?
Yes, a little bit. First of all, you always check the grown horn, so you make the same you do, like you clean the space between the bars and the grown horn and the heels, so you see how much horn is grown. And then I always try a little bit to find out the flexibility of the deep distal flexor tendon, in particular if I have a laterality thing or if I have a very contracted one. And then I also have always in my car a little wedge pad, and I tape it with duct tape underneath the hoof to check if the hoof can stay a little bit lower angle, and then you can let them stand and walk and just check the comfort. It's a very good thing. So in particular, if you tape it on the hoof, you set up your car, you watch the horse, so you don't lose a lot of time. It's a 2 minutes test, and the horse will definitely show you if it's more or less comfortable. In particular, in laterality patients, I do it quite a lot.
Great, thank you, Jenny. Round of applause to Jenny, please.